I'll be presenting on the pooled donor funding in the support of the HSSP in the context of suspended donor support. So around 2012, with the infamous Cashgate Scandal, the donors actually pulled away from directly supporting it in the country. And the big ministries like the Ministry of Education, Ministry of Agriculture, including Health, this impact will actually be felt even bigger than other ministries, I would say. Out of that, the government of Malawi, with its development partners, came up with the HSJF to support mainly the HSP2, as well as also support the realization of the universal health coverage. Next. And then this fund had so many motions it had been supporting, and probably still, including the medical equipment, healthcare services, the Malawi blood transfusion invoices payment, Umoyo houses construction, developing research capacity, for example, in HELP, and then emergency rates, as well as the construction of health facilities. Next. But then over the period of visitation, actually there was no evaluation to look at its performance over time, despite there were a couple of studies that took place that actually looked at the funding as well as looking at the M&E, but there wasn't this robust way of looking at the performance of the fund in order to inform its future performance, as well as identify the bottlenecks that would improve its performance. And therefore, this analysis was instituted to look at the performance of the fund in the period in which the HSP2 was being implemented. Next. So specifically, we wanted to assess the extent to which the fund's objectives were aligned with the HSP2, and assess the planning, execution, sustainability, as well as identifying underlying bottlenecks and the proposed potential solutions to address them. We also wanted to look at the economic evaluations on the motions that were being implemented by the fund or under the fund. So the study took place across the country with selected districts, which were part of the in which these implementers were actually located. So the study also looked at responses from the national as well as at local level, at the implementation level, and then the facility level, and the policy level. Yeah. Next slide. So we used mixed methods, and also this was complemented by desk reviews, but we executed the key informant interviews. In terms of analysis, we followed the OECD just to look at the relevance, effectiveness, efficiency, sustainability, as well as the equity in which the fund was being implemented. We also looked at the cost effectiveness of the motions, but also to look at its aligning to key principles of aid effectiveness. We adopted the evaluation framework by COPIN 2012. Next slide. So looking at the findings of this study, in terms of relevance, we found that most motions that were being implemented under the fund were well aligned and strategic in meeting the objectives of the HSP2, and it was also responsive to public health emergencies. And based on the key principles of aid effectiveness, the fund performed very well, around 67. But we would also see that when it comes to alignment and mutual accountability, the fund did not perform very well, because especially on mutual accountability, because by then, I think there was no M&E structure that was put in place. And as a team, we're also told that we should also take part in coming up with a framework for an M&E for the same fund. And over the period of its implementation, there was a steady increase in terms of funding to the motions that were being proposed by government. However, we may also see that there is suboptimal utilization of the funds. Almost half of the funds that were earmarked for these motions were not used over the period. Especially, this is quite significant in the motion 1, which is on construction, and motion 14. Probably this was because of the bureaucratic processes that these procurements as well as construction of facilities would actually require, and that took a longer time, and that the utilization also was affected in the course. And another important key finding was that the investments, especially on vaccine, showed a significant high positive return for every $1 invested of vaccine, and there was $641 that were vetted. Similarly, we saw a similar significant cost benefit in family planning and outreach services that were being funded by HSJF. And the purchasing and installation of the CT scan machine at Queen's also showed some significance. When we compare the scans that were done at Queen's and if this same service was to be accessed somewhere else, and the closest we had was Mwaiwatu, you'd see that there was a lot of funds that were saved because of purchasing and also installation of the CT scan machine at Queen's. And this was also collaborated by the key informants' sentiments, who said the purchasing of the CT scan machine was a vital investment in helping, and it is helping a lot. The machine costs around $687,000, which was cheaper. We procured some at $1 million. These are huge, very expensive machines, and this at 68, meaning the current one at Queen's at 687,000, very fair. The capacity of this scanner is 128, double as much compared to the one that is at KCH, and it is the very top range of the machine that one would get on the market. When we also look, I think this is similar to one of the slides my colleague also presented recently. So when we look at the sustainability of the SLA, which was also being funded by the HSJF, it showed that if you compare both the private sector as well as the central medical stores, it shows that the services that were being supported by the HSJF were lower. And the fund also demonstrated equity in actually sustaining some of the services that would have not been accessed if such kind of fund was not available, or could be difficult to access them because people living, say, in hard-to-reach areas were able to access the family planning methods, family planning facilities through the Banjaland Sogoro Fund, and as well as procurement of this equipment, which would otherwise be difficult to, say, access CT scan machines for people that could not have capacity to do so financially. But what we also note is that the funding actually lacks sustainability, because there's absence of reliable maintenance strategy, for instance, of infrastructure as well as machinery that have been procured, and there's inadequate technical capacity building and lacking initiatives in filling prevalent staffing gaps at the Secretariat. So this also contributes to low absorption rates as well as the actual performance, the speed on how activities are being executed at the Secretariat. Another factor that we saw was that the lack of existing strategy. If the fund pulls out, what else happens? Yeah. In conclusion, we are saying, therefore, that the HSJF, as a pooled fund, has demonstrated efficiency in supporting the HSP2 and sustaining the strides towards the universal health coverage vision in the context of limited health resources following the suspension of direct budget support. And however, the arrangement did not put in place the ways on how this fund could be sustained. Additionally, despite that there was steady increase in the funding over the period, its utilization was quite suboptimal, especially in some motions which I already mentioned, like construction, as well as purchasing of medical equipment, which was mostly due to bureaucratic ramifications, which, if taken care of, that would be addressed. And another thing we noted was while there's need to upgrade the HSJF into a multi-donor trust fund, improving devolutions mechanisms as instituting a robust M&E, which has already been put in place now and maybe to be rolled out soon, could increase absorption rates and improve the fund's performance. So in the course of inflation, sometimes delays in the bureaucratic response to requisitions that are made, you find that this contributed a lot to suboptimal utilization of the resources. So I think I have to acknowledge the team from HEP, the Minister of Health, and also other partners that we conjointly worked on this project. Thanks so much.